You may be at risk for vitamin D insufficiency if you avoid the sun, have milk allergies, or follow a strict vegan diet. Vitamin D, sometimes known as the sunshine vitamin, is created by the body in response to skin exposure to sunlight. It's also found in fortified dairy and grain products, as well as a few meals like fish, fish liver oils, and egg yolks. Vitamin D is necessary for strong bones because it aids the body's absorption of calcium from food. Vitamin D insufficiency has long been linked to rickets, a condition in which bone tissue fails to mineralize effectively, resulting in soft bones and skeletal abnormalities. In today's video, we'll talk about vitamin D deficiency, symptoms, treatments, causes, and more. Subscribe to our channel so that you don't miss our videos in future. Also hit the bell icon to get notified every time we upload one. Let's get started. Vitamin D, also known as calciferol, is a fat-soluble vitamin that can be found naturally in a few foods, added to others, or purchased as a dietary supplement. When ultraviolet, UV, rays from sunshine strike the skin and activate vitamin D production, it is also created endogenously. Other functions of vitamin D in the body include inflammation reduction and control of cell proliferation, neuromuscular and immunological function, and glucose metabolism. Vitamin D influences the expression of several genes that code for proteins that control cell proliferation, differentiation, and death. Symptoms of vitamin D deficiency: being sick or getting infections often. One of vitamin D's most critical functions is to maintain your immune system healthy so that you can fight off viruses and bacteria that cause sickness. It interacts directly with the cells that are in charge of battling infection. Low vitamin D levels may be a contributing cause if you become sick frequently, especially with colds or the flu. Fatigue and tiredness. Tiredness can be caused by a variety of factors, including vitamin D insufficiency. According to case studies, very low vitamin D levels in the blood can produce weariness, which can have a significant negative impact on quality of life. The effects of vitamin D on exhaustion and sleep quality have also been studied in children. Low vitamin D levels were linked to lower sleep quality, shorter sleep duration, and later bedtimes in a study of 39 children. Bone and back pain. Vitamin D is beneficial to bone health in a variety of ways. It helps your body absorb calcium, for starters. Inadequate vitamin D levels in the blood can cause bone pain and lower back discomfort. Impaired wound healing. Slow wound healing after surgery or injury could indicate a deficiency in vitamin D. In fact, data from a test tube study suggest that the vitamin boosts the creation of chemicals that are essential for wound healing and the formation of new skin. Vitamin D insufficiency hampered several elements of healing in persons who had oral surgery, according to a study of 4 research. Vitamin D's involvement in reducing inflammation and fighting infection has also been considered to be vital for healthy healing. Patients with diabetes-related foot infections were studied in one study. It was shown that people with severe vitamin D deficiency had greater levels of inflammatory markers, which can impede healing. Bone loss. Vitamin D plays a crucial role in calcium absorption and bone metabolism. Many older people who are diagnosed with bone loss believe they need to take more calcium. However, they may be deficient in vitamin D as well. Low bone mineral density is an indication that your bones have lost calcium and other minerals. This places older adults, especially women, at an increased risk of fractures. Anxiety. As with depression, there may be links between vitamin D deficiency and anxiety disorders. According to one review, levels of calcidiol, a form of vitamin D, was found to be lower in people with anxiety as well as those with depression. A separate study in pregnant women found that vitamin D levels could help reduce anxiety, improve sleep quality, and possibly help prevent postpartum depression. Treatment for vitamin D deficiency. Treatment for vitamin D deficiency involves getting more vitamin D through diet and supplements. Although there is no consensus on vitamin D levels required for optimal health, and it likely differs depending on age and health conditions, a concentration of less than 20 nanograms per milliliter is generally considered inadequate, requiring treatment. Natural remedies. Aside from vitamin D supplementation, your doctor may recommend adding more vitamin D-rich foods to your daily diet. Options may include fatty fish, egg yolks, fortified cereals, milk and juices with added vitamin D, yogurt, beef liver. Since sunlight is also a natural source of vitamin D, your doctor may recommend going outside more often. Causes of vitamin D deficiency. Vitamin D deficiency can occur for a number of reasons. Number 1, you don't consume the recommended levels of the vitamin over time. This is likely if you follow a strict vegan diet, because most of the natural sources are animal-based, including fish and fish oils, egg yolks, fortified milk, and beef liver. Here are the best vitamin D foods for vegetarians. Number 2, your exposure to sunlight is limited. Because the body makes vitamin D when your skin is exposed to sunlight, you may be at risk of deficiency if you are homebound, live in northern latitudes, wear long robes or head coverings for religious reasons, or have an occupation that prevents sun exposure. Number 3, you have dark skin. The pigment melanin reduces the skin's ability to make vitamin D in response to sunlight exposure. Some studies show that older adults with darker skin are at high risk of vitamin D deficiency. Number 4, your kidneys cannot convert vitamin D to its active form. As people age, their kidneys are less able to convert vitamin D to its active form, thus increasing their risk of vitamin D deficiency. Number 5, your digestive tract cannot adequately absorb vitamin D. Certain medical problems, including Crohn's disease, cystic fibrosis, and celiac disease, can affect your intestine's ability to absorb vitamin D from the food you eat. Number 6, you are obese. Vitamin D is extracted from the blood by fat cells, altering its release into the circulation. People with a body mass index of 30 or greater often have low blood levels of vitamin D. When to see a doctor? Because the symptoms of vitamin D deficiency are often modest, most people are unaware that they are insufficient. Even if they're negatively impacting your quality of life, you might not notice them right away. If you notice any apparent symptoms and have any risk factors, you should consider contacting your doctor to check for vitamin D deficiency. A blood test will be used to determine your vitamin D levels. If you enjoyed the video, quickly smack the like button and share it with your friends. If you haven't subscribed to the channel yet, please subscribe and hit that bell icon so that you do not miss our next videos.